This conference will now be recorded.
So I see a lot of repeat names. I know many of you were in the 3 previous calls, and we're so excited that you're back. This is number 4 in a series all this week. We hope that you'll be able to join us for some of our future trainings this week and even further in the future. So without further ado, I'm going to hand it over to Emily Carmody to get us started.
Hey everyone, thank you so much for joining us this afternoon for our policy and procedures, program standards, collaborative policy review and monitoring session. So it's quite a long title, and hopefully we can get through all of our slides today and have plenty of time for questions for you all. And I know this is going to be the first kind of introduction and overview of the policies and procedures, but we will have many months ahead of us talking through these and how we can meet those. And Sarah, I think I don't have control anymore if you want to pass it over again.
Yeah, absolutely. Just give me one moment to do that. How's that?
All right. So today we're going to be reviewing a lot of resources for our rehousing agencies to help you all with implementing best practices out in the field. We really want to make sure that as you all are ramping up very quickly to address the needs around COVID and the homeless population, that you have the confidence and the support to be implementing rapid rehousing and targeted homeless prevention using the best practice models that we know in our field. So we have our program policies that we're developing that'll help guide you along the way. We want to make these as transparent as possible so that you know what the program policies are and can understand them and explain them. And I will say that we think of policy development as an iterative process with Back at Home, meaning if we develop a policy and it's not working, we want to hear feedback about it and see if we can get around the barrier that we created with that policy or help to address it out in the field. So we really think of these policies as a good first version, but we may have updates and changes to those policies based on feedback from the field. We also have program standards that we have established for Back at Home CV, and this is really to again make sure that the rapid rehousing and targeted prevention programs that are operating under Back at Home CV are utilizing best practice standards for the field, and this is really at a national program standard level. We're going to be implementing a collaborative review process that we'll talk a little bit about today in the coming weeks, and then also review monitoring and how we use monitoring to help support you guys out in the field as well. All right, so why in the world do we have policies and procedures and standards? Why do we need to write these down? And I think I can say this clearly after being in the field of social work for over 20 years now. We do a lot of verbal history where we are told how a program works by whoever is our mentor or supervisor when we come into a program. And oftentimes as programs, we don't do the best job of writing down policies and procedures and how things work. But unfortunately, what I've seen over the years in our field is that as someone leaves the position or there's staff turnover, or if you're trying to ramp up really quickly and train new staff, if you don't have it written down, it actually makes it really challenging for programs to transfer that knowledge quickly and to have everyone kind of rowing in the same direction. So we want to make sure that we have policies and standards so that we're providing coordinated program across the entire Back at Home CV coverage area, which is 90 counties in our state. And we want to make sure that when folks are receiving rapid rehousing or targeted homeless prevention from Back at Home, that it's a quality program, that we have a quality review process with that. So we have some key partners that are really helping us to implement program policies and standards. So our partners over at the North Carolina Department of Health and Human Services are the administrative agency and the ESG CV HUD recipient. So they are working to help us to help develop program policies and standards and really make sure that what we're putting out as program policies for back at home CV meet the ESG CV regs and guidance. And they're also holding the contracts with you all as rehousing agencies, and we'll be monitoring based on those contracts and reviewing requisitions based on those policies. So we know that we want to be as clear as possible when we're telling you how to spend the money so that you all feel comfortable and feel like you're supporting families and doing it according to the regs and what they need to be. For the coalition, our field support is really where we come into play. So the North Carolina Coalition to End Homelessness is going to manage the field support for our rehousing agencies. You heard from Sarah. I know you've heard from Cheney Stokes, who hosted our call this morning, myself, Emily Carmody, and then Tom Albanese is a contract TA provider that we're bringing on as part of our team to help with field supports for rehousing agencies. So for this, in this role, NCCH is helping to draft and develop those policies and procedures with DHHS and the ESG office. We're creating ongoing training curriculums and coaching supports, and really having the policies and the program standards outlined for us is super helpful, so we know what to train to and we know where we're all headed or what our goal is for how rapid rehousing and targeted homeless prevention should be implemented in the field. And we will be reviewing the rehousing agency's policies and collaborative review process that I'll talk about a little bit in some future slides. But most importantly, and I think we've said this multiple times already this week, a key partner in all of this work is you as the rehousing agencies. As I said, we really view you all as key players in the field and key providers of feedback on policies and anything that could be helpful for other rehousing agencies to know, and also helpful for program leadership to know in terms of barriers or things that we need to change to overcome those barriers. So for you as rehousing agencies, we want you to actually participate in the collaborative review process with us. We'll talk a little bit about what that looks like. We will have these ongoing trainings and be providing them to your rehousing agency staff. So we want to make sure that we're providing trainings that are useful to you. So we would love to hear ideas from you all about useful topics and a lot of things that we could do kind of a deeper dive training on to help support your agency. We really think that you all can help with developing good policies and procedures that meet these standards that we'll talk about, our program standards. And we would love to share policies and procedures that meet our standards with other agencies as examples. I know you all learn a lot from your peer-to-peer relationships, and we want to be able to use good examples of programs in North Carolina that are implementing rapid rehousing and targeted homeless prevention in accordance to the program standards. And so we may be asking to be able to share your policies and procedures with others. You all are, of course, the key piece of implementing the best practices out in the field. You are where the rubber meets the road with our program, and so we want to make sure we're supporting you to have the confidence that you are doing that according to best practices. And as I said, providing that feedback loop for us. And also, I think the other really cool thing that I just want to underline here is that you all are the ones that will be bringing to light emerging best practices. We have best practice program standards that have been established nationally, but I know that in each of your rehousing agencies, there are stellar case managers, stellar landlord engagement specialists who have really cool practices that it would be great to share with other rehousing agencies. So if you feel like your agency has kind of stumbled upon something that's working really well in your community, that's just another thing we love to hear about so we can share with other rehousing agencies, really kind of cross-pollinate good ideas across the state. So let's talk about policies and procedures. So a lot of our trainings this week are covering pieces of the policy and procedures. For example, you all went over eligible expenses yesterday. You went over referral process this morning. You'll be going over the unit documentation process with me tomorrow afternoon. We've got HMIS data entry. So all of these are part of the policies and procedures for our program. So I'm not going to read through, thank goodness, on a Tuesday afternoon. I'm not going to read you line by line policy and procedures, but I wanted to talk about 3 key resources for you all that will help you to become familiar with our policies and procedures as a Back at Home program, and that we're trying to have for you guys so that you know where to go to look for these different pieces. So the 3 resources that we think are the key things for you all to be familiar with are the Program Standards and Handbook for Back at Home CV, the North Carolina ESG Desk Guide, and then the our resource portal that we're developing. So we are working to write down everything that we're presenting this week. So I don't know if y'all remember back to yesterday morning with the GIF of the cat furiously typing on the computer, but that really is what it looks like to be writing down all the different policies and procedures for this program. We will have a written out narrative explainer of our referral and prioritization process, including an appendices that explains any specific variations for each community. We are writing out the different unit recruitment supports and the documentation that you need for each unit for rental assistance. We're writing out even some further information about the supportive services we would want you to provide, grievance policies, termination and appeals policies for folks who are terminated from your program, why they would be terminated, and then an appeals process that would follow from that. The use of eligible funds, so everything that you reviewed yesterday afternoon about what's eligible to use for funding will be in this. The requisition process, the data collection process, monitoring, which is what we're going to go over this afternoon. We have a fair housing statement and a marketing statement as well in these policies in this handbook. So we are working on getting version 1 of the handbook out to you all very soon, and we will be emailing this, posting it, and also emailing it to our rehousing agencies so that you all have a copy of this standards and handbook for your program. So at certain points, we have quite an overlap between Back at Home CV and the ESG current desk guide. So there will be times in the handbook that the handbook will refer to the ESG desk guide for policies. So the ESG desk guide is available on the North Carolina Department of Health and Human Services website under the ESG program. We will also have a link of that in a portal that we're developing for you all that I'll go over in just a minute. But where we see that the program policies are just so closely aligned with ESG policies, rather than rewrite it, we just refer to the ESG desk guide in that handbook. So this is another resource that you all should be familiar with and really help you all with implementing your program. And finally, we're developing what we're calling the resource portal. So you all will have access to this portal, and each rehousing agency will need to let NCCH know who they want to have access to the resource portal. But this is a snapshot of what the portal looks like. And what each of these boxes are is a button that when you click on it, it would take you to a link to a document. So this is where we're going to have the standards, the program standards and handbook, a list of the eligible expenses, the desk guide, the program standards, eligibility and referral processes. We'll have HMIS documents and workflow that you all will need for data entry in here as well. We're trying to put all the resources that you all will need to implement Back at Home out in the field in one spot, so that you all can train your case management staff, your program management staff, that this is where they should go for those resources, and really try to consolidate it all for you all so you're not having to train on a million different systems or sites. So as we develop new resources, we will post it to the resource portal and let you all know that it's posted. And this is also a good way of making sure you have the latest version. So as I said, we view really creating policies as an iterative process, meaning there may be version 2 of the program standards and handbook released at a later date. We will make sure that the most updated version is on this portal so that you all have that in your hands and know that you can always go to this one spot to the latest version of all of your resources. We are still, I saw that question, Tanya, we are still building out the portal, but we are trying to get you guys access as quickly as possible. But please anticipate an email from us trying to gather information for the email addresses for who this should be shared with your rehousing agencies, either by the end of this week or next week. We're looking to share that out with you all. All right. So I want to dive into the program standards. So these are a little bit different than policies. So policies and procedures are how you operate a program and what are the rules and the boundaries of your program. Program standards are the quality, right? This is the quality that we want to be delivering our services at. And really what program standards do is they set a goal. They set the bar height of where we see as our goal as a program of how we're going to provide services out in the field. And this is a goal that we're all going to be striving towards. Rehousing agencies will be striving towards those best practices. North Carolina Coalition to End Homelessness and their field support team will be striving to support you in achieving these standards. And the ESG office and Back at Home CV will be looking for you guys to meet these program standards out in the field so that we know we have a quality program that we're funding with this funding. So this is really, it's a goal, and I want to say that we're not anticipating everyone is going to be able to meet all program standards at the start. There's several program standards that we clearly outline in our documents that we're hoping you can meet it by the end of the first year, but we're not expecting you to have it from the very beginning. So these program standards weren't just created for Back at Home CV. We actually use the National Alliance to End Homelessness, their rapid rehousing program standards. And the National Alliance to End Homelessness developed these program standards with the Department of Veteran Affairs, the VA, HUD, the U.S. Interagency Council on Homelessness, and APT Associates, and other federal technical assistance providers all came together, including Tom Albanese, which is great that we have him on our team. He helped to write the document. So, and what they looked at is across the country, what were the best practices for providing rapid rehousing, and they created this program standards document. So for Back at Home, we're expecting all of our rehousing agencies to adhere to these standards for both rapid rehousing and targeted homeless prevention assistance. So the original document created by the National Alliance to End Homelessness really only addresses rapid rehousing, but we have reviewed these and they are so similar for targeted homeless prevention that we have clearly outlined that we are expecting our Back at Home rehousing agencies to follow these standards for both folks who are serving under rapid rehousing and targeted homeless prevention. So we are going to be using these program standards as really the foundation that we support you all as rehousing agencies. So again, as I said before, we will be working to provide training and support to rehousing agencies to help understand and implement these program standards. We want to make sure that we, if we see an area that seems to be a place where a lot of folks need support, then we'll provide a training on it. We're here to really help you guys meet these standards and provide you whatever resources it is that would be helpful to get you there. So we really see this as a team approach and as coaching rather than as expert, because you all have expertise in providing rapid rehousing in your community, and we can get you there we can help coach you to meet the standards there. And then the North Carolina Department of Health and Human Services and the ESG office will use the program standards to review current and ongoing program performance. So Chris will talk a little bit more about that with monitoring, but this is something that they will also be using for contract performance. So when you read the program standards document, you'll see that they are divided into 4 different categories. There's the housing identification standards, and this is really around landlord engagement and how programs identify landlords that they will work with and identify units for the households that they are working with. This goes to how do you train folks on landlord engagement, fair housing policies.
Because I can't hear.
Sorry, there's some noise. So housing identification standards really are about how do you obtain that household, those units for households. The rent and move-in assistance standards go to how the program provides rental assistance to households. And I think this is really going to be a growth area for a lot of our programs. We are looking for, as the program standards outline, programs to provide what's called a progressive engagement or a progressive assistance model when it comes to providing rental assistance for households. So really working with each household month to month to figure out what is the exact amount of money they need to help support the rental payment that month, rather than offering a set prepackage such as everyone gets 3 months of rent and that's it for our rapid rehousing program, or you know, we pay 75% of the rent for everyone and there's no variation. So with our program standards, we're saying that we need to look at each household and really move with them to provide them just enough assistance to cover the rent and allow them to start supporting pieces of their household expenses as they go. The third category that the program standards are divided into are case management and service standards. Now, I will say in the case management and service standards, there are some modifications that we made for back at home CV because of COVID. So there's several different standards that talk about home visits, seeing someone inside their home, meeting them out in the community, that we had modifications that we added so that you all could maintain the standards of case management within a COVID setting and during the pandemic. And then finally, program philosophy and design standards. So these are really just about the approach. You know, we use a housing first program philosophy and really looking at solving housing crises as quickly as possible for folks. So as I said, we have modified these standards from the original National Alliance to End Homelessness tools. So we are including targeted homeless prevention in those standards, even though they were originally just written for rapid rehousing. We reviewed them all and feel like they all apply to targeted homeless prevention standards as well. Some standards will be met just inherently through how we're designing back at home CV. We're using these standards to help us guide our program design. So pieces around the referral process and participating in coordinated entry and things along those lines are already going to be met just by the back at home policies and procedures. So it's not something extra that you all need to do as a rehousing agency on top of what we're already doing as a program. And as I said earlier, we're modifying some of the case management and services standards due to COVID-19 so that we're making sure we're keeping your staff safe and also the households that we're serving safe in the midst of the pandemic. So again, rather than reading each line by line of the program standards, we will be releasing those program standards to you all via the portal by the end of this week or the beginning of next week for you all to review. Please feel free to review those, reach out to myself or any of our staff at NCCH to follow up on those standards if you have questions. And then as we move through introducing the program standards to you all out in the field, we will be starting a collaborative review process with all of our rehousing agencies. So this is where we get to begin as our first team project with Back at Home is our collaborative review process. And again, we really feel like this is part of the team. we are looking at having you all submit your policies and procedures to us for review to see how they meet the program standards that we have established. So if you're a rehousing agency with existing rapid rehousing policy and procedures and homelessness, targeted homelessness prevention procedures, we would ask you all to do a self-review tool that we will be giving you all based on those program standards. So we want you all to look at your own program standards and evaluate how you think that your current standards meet the program standards as outlined for Back at Home. And then you'll submit both the self-review tool and your policy and procedures using a form that we'll send out to you. And you'll submit those to our field support staff. The field support staff will review both your self-evaluation and the policies and procedures, and then set up a time to review our feedback or edits, suggested edits, and identify any areas for supports or training that you feel like would be helpful for your rehousing agency. So again, if you have existing policies and procedures, it'll be a self-review tool that we'll send out, and then you'll submit that with your policies and procedures for the field staff team to review, and they'll reach out to you after they've finished reviewing to set up a phone call and go over the feedback. So we know that there's several rehousing agencies that are participating in Back at Home CV that have not had an existing rapid rehousing policy, or program prior to this. So if you do not have existing rapid rehousing policy and procedures, that is A-okay. The field staff is here to support you. We really want to help you in creating policies and procedures that meet program standards from the start. We will be also looking, as I said earlier, to the policies and procedures that other rehousing agencies are providing and asking if they are willing to be examples or samples policy and procedures for our rehousing agencies that don't have current policies yet. So we're hoping that we can provide some samples for you all from other rehousing agencies, and again, work with you to identify those areas for supports and training where you feel like you really need some support in order to get things going out in the field. And we also recognize that some of these areas of support and training may be a little different for folks who've done rapid rehousing and targeted homeless prevention before. You may not need all the same trainings as someone who is just starting, and we understand that and are looking to be flexible in how we provide that training for both categories of agencies. So what is it? You have to repeat things 8 times for adult learners to hear it. So here we go. One more time. The collaborative review process is really 3 steps. We'll send out a self-review tool that you can use, as we'll submit 1 per agency, please, but you all will use that to evaluate how your current policies and procedures meet program standards. You'll send in that self-review tool and your policies and procedures to the field support staff via a form that we'll send you. And then we will schedule a follow-up conversation with you all to discuss those feedback, answer any questions, and then identify the areas for support and for training for future trainings with Back at Home. All right. So Chris, I'm going to turn it over to you to talk through monitoring.
Sounds good. Uh-oh. Can you hear me? Oh. All right. Can you hear me now?
Yes, that's much better, Chris. Thank you so much. No, okay. That's good.
All right. All right. I'm just going to touch bases on monitoring, and I shouldn't say touch bases like that, like it's such a small thing. Monitoring is pretty big. But here at the ESG office, as Emily mentioned quite a few times, that we're responsible for the oversight of the ESG CV funding, and the monitoring is a great portion of that. The North Carolina ESG office, as you all know, the funds were allocated through the CARES Act to address the crisis due to the pandemic that befalls us as far as homeless prevention, homelessness, rapidly rehousing folks. We want to prevent, prepare, for the response. So these funds and Back at Home has been designed specifically as a response in the state of North Carolina to the pandemic in our area. So I'll just address some of the monitoring. Back at Home specifically, ESGCV funds multiple activities, including emergency shelter, street outreach, and some other activities. Back at Home specifically, funded activities are rapid rehousing and prevention. So those are what this specific session will deal with as far as monitoring is concerned. Next slide. Thank you. The ESG office, just a little bit about the role of our office. Of course, as you all know, the funds come down from HUD. We as a recipient through the Department of Commerce, it comes to DHHS and DAS, which is where the ESG office sits. And then we issue the funds out to you all who are then the subrecipients. Next slide. Our responsibility as far as monitoring is concerned is to determine who is eligible to receive federal assistance. We also make sure that the performance measures in relation to whether the objectives are meet the federal program, sort of what Emily made reference to with the performance standards that you guys are being provided, and we will monitor those to make sure that those fall in line with the federal program standards, which of course they are probably a bit more of what's required. But if you as you guys work to achieve those program standards, that ensures us that you are indeed going to be able to meet all federal and state guidelines that's part of the ESG program. Next slide. ESG funded organizations responsibilities. One thing that we all know that this is a contract, and it's a contract that between your agencies and the ESG office. And within our contract, of course, we want to make sure with monitoring that, as I mentioned previously, that federal regulation, HUD regulations, and specifically are being adhered to and you guys are in compliance with. So some of the key elements that you will notice in our desk guide and for performance standards that we sort of make certain that we identify and single out when we're doing monitoring is, of course, coordinated entry, where you all are required to be a part of coordinated entry. Back at Home has done a wonderful job sort of pulling those pieces together, have trainings. I think there was a training this morning on prioritization and some of those different things. So the coordinated entry is a piece that we know is implemented in Back at Home. Those are things that we look at, coordination with your targeted homeless services, data collection, which would be your HMIS, and for your DV agencies, the comparable database. But we want to make sure that the proper data that's required by HUD is being captured by all agencies. The homeless participation, that's part of one of the key elements. And of course, the COC written standards. The real written standards sort of guide everything. As you all know, written standards have been in place and required by all agencies receiving ESG funding. And again, the written standards tie back into those program standards that Emily mentioned earlier. We feel certain that as you guys work to achieve those program standards, you'll see your written standards will be a part of that process, and you'll be in compliance with ESG regulations. So I just urge that as you guys work with the Back at Home team, that as you self-monitor and self-review some of your policies and procedures and work and look at some of the program standards in place, if you don't already have that in place in your agencies, as you work with the Back at Home program, that will solidify you in terms of having what is required for HUD. And when monitoring happens at your agency, you'll know and feel comfortable that you will be in compliance. Eligibility is very important as well. Eligibility, as I mentioned on yesterday's call, determines whether, and I hate to use this word, but whether you may end up having to pay back funds or not. What we don't want is have an agency serve a client or a unit and find out that the unit or the client was not eligible to be served under ESG CV funding. So these are key elements within monitoring that we make sure that we sort of identify and work with you all. And again, I think Back at Home has done a good job at preparing the program so that each agency, each rehousing agency will have no problem adhering and falling in line with the key elements here provided. Next slide. Purpose of our monitoring, again, is to ensure compliance with state and federal requirements, make sure that each agency is carrying out activities according to their contract. Again, in the contracts simply will have outline your performance measures and those things that are required for the particular ESG activity that you guys are being funded for, whether it be rapid rehousing, prevention, or a combination of both. Want to make sure that expended funds in timely manner. We understand that we're in a different time now. We're dealing with money that's at a much higher level than we have in the past. So there may be some rapid rehousing agencies or agencies on this call that have previously received funding from our office. And yes, we still are expecting funds to be spent in a timely manner, but we do understand that we're working under a new set of everything now in 2020. Things are just so different. So we understand how some of these programs are being prepared and ramped up, and some haven't even been in existence before. So we take all that into consideration. But we just want you to understand the items and the things that we are looking for when we're monitoring. So spending funds is important. You want to make sure that all your costs are eligible expenses. That is very important. Again, that falls back to ineligible and eligible. Those types of situations can cause a problem within your agency that could lead to a payback, which we don't ever want to have happen. So we want you to be conscious of what expenses are eligible. As we often mention to our agencies, our desk guide sort of will, when it comes to eligible and not eligible expenses, allowable things of that nature, is sort of the Bible for you when it comes to ESG funding. So if you have any questions or concerns about any of those things, your desk guide and the other tools that the Back at Home team will provide for you will help you out in that in a great way. We also want to make sure you have adequate control over program financial performance. Again, this one, probably I would have highlighted it if I had an opportunity to, didn't think about it. But after doing some work in the office yesterday, just the number and the dollar amounts that have been awarded are extraordinary compared to what we funded in the past. And just looking at the agencies and the amount of money and all that's expected and required of you all, our program and financial performance is key. So we want to make sure that the agencies have the capacity to not only have the control over the program, but also understand the magnitude and the level of financial resources you have at your disposal, and that's being used accordingly. Make sure that the capacity to carry out the project. I think one thing that Back at Home has done, they've provided the opportunity for those rehousing agencies that have little experience or little ESG experience, the training tools, the trainings like we're having here now, and trainings forthcoming that will give them, that would help build their capacity to carry out the program, even if it's staffing or training older staff that were previously there to just sort of the new Back at Home sort of model. And also always documenting eligibility accurately and adequately. That's what we look for in monitoring as well. With all that we just mentioned in the previous bullets, if when monitored, we monitor a client file or requisition and the documentation is not accurate or it's not adequately prepared, that could undo all of your great work. So we want to make sure that as you all prepare requisitions for submission, you want to make sure that you dot every I, cross every T, have a second set of eyes, look at some of those documents for your caseworkers. You want to make sure your executive directors that you have the proper reviews in place so that as they build client files, that they are actually making certain that they are gathering the proper documentation, but also making sure that it is accurately documented, signed, and those types of things. You don't want something that small to cause an issue with your funding. Next slide. Our objectives for our monitoring, again, we want to make sure that we identify areas where assistance is needed. I believe monitoring back at home may be a bit easier than monitoring our traditional ESG process, because I think you guys have enough of assistance and training to prepare for this program as you work through it. So areas where assistance is needed should be identified before we even have an opportunity to monitor. So it should be cleared up. We may not even know that it existed, but if it does exist, we want to make sure that we provide that assistance that may be needed in those areas. We want to be able to provide clarity and guidance for any of guidelines or ESG rules that might federal regulations that apply to your grant. We want to ensure existing compliance issues are resolved. Fortunately, I don't believe we have any agencies that were awarded that currently are under any type of compliance issues with our office, so that's a good start for us. We want to make sure that we provide the tools necessary and ensure that all files are maintained accurately. So those are things that we want to make sure that monitorings are. Objectives of monitoring are not, of course, we are not out to catch the organization red-handed. I learned that a long time ago that as we monitor, I want to make certain that we're not going out to look for certain things. We're making sure that we're coming in to provide the assistance if something is not in place, or if something is not if something is not exactly the way that it should be in a particular program or activity funded by ESG. We don't ever want to recapture funds or take away money. We don't want to restructure organizations or do business for you all. We just want to be of assistance. We want to provide that technical assistance needed so that you can effectively apply and provide that money to those that are in need within the communities across the state. Next slide. Monitoring types. ESG monitoring types composed of desk monitoring, which we actually would send out emails to each agency requesting a client file based on a HMIS number or client ID number. That those particular files would be sent in to us. We would do pretty much the same as the monitoring that we would do on site. Our expectation right now is with COVID and all that's going on, that on-site monitorings will be suspended at least until the end of the year. So all of you all that are receiving rehousing funding from us will receive a desk monitoring. Some sort of communication will be provided to you from our office so that you'll be able to provide that information to us. But I just wanted you guys to be aware, because again, this is a 24-month contract, a 24-month program. On-site monitoring visits will resume sometime, hopefully. As with everything going on now, nothing is written in stone. Everything is so fluid, so I don't want to give you a date or a time on that, but I can let you know that we have suspended them until the end of the year. There could be a time where there's an on-site unannounced visits. Unannounced visits are conducted based on particular factors. If we just feel we need to come to an organization and just monitor the program and see where you are at that particular point, but we just have to let you know that on-site unannounced visits are a possibility. Habitability standards. All units receiving housing stability must meet habitability standards. This is one of the great things I love about back at home, is that they have the HQS inspections already in place for those agencies that have rapid rehousing, and you have had your case managers or whomever do inspections. I think this is one thing that's going to be that you will enjoy and have the opportunity to have those types of things already in place for you. But these are the monitoring types for the ESG program. Any
Well,
questions?
great. Thanks so much. Yeah, I think we have plenty of time for questions from the group, and I believe we have some already in chat at the moment. So I see a question from Tina Willis in chat. If the copy of program operations manuals is part of acceptance of funds, will these have to be adapted instead of our current ones? So Tina, the program operations manual or policies and procedures, that would be part of that collaborative review process. So we'll ask you guys, if you have them, to do the self-review tool and then submit that with your policy, programs and procedures or your operations manual. And then one of the field staff will review those to see how they meet program standards, and then have that follow-up conversation with you all. To see if there are needed edits. So I can't answer that off the top if there will be needed edits or changes, but just know that that's part of the collaborative review process. So Sarah Lancaster, thank you for this question. It's a really good one. And Chris, I'd love to get your opinion on this as well. Sarah asked, if we are sub-granting or contracting, if they're the fiscal sponsor, which agency is responsible for policy and procedure? Obviously, the grantee or the sponsor would provide oversight and ensure compliance and adherence to policy, but wondering which agency would hold the policy. Please advise. Chris, do you have any opinions on that for Sarah?
I believe she's referring to the actual program policy, correct? The agency that's actually administering the program, pardon me? That is correct,
Yes,
right?
that's
And that the
correct.
policy she's referring to, yes. Well, our expectation would be that the agency that's actually administering the program on the ground, that they would have access, that they would be the holder of the policy, but being a fiscal sponsor, we make certain that all fiscal sponsors have access and are aware of all program policies and procedures that your sub-grantees are maintaining, that you do a self-review or sort of a monitoring of your sub-grantees just to make sure that those things are in place. You don't have to have those in place, but the things that we require, we expect the fiscal sponsor to ensure that the sub-grantee has those things in place and on site.
Thanks, Chris. And Sarah, so if for you all, the sub-grantee, it would be great. They should be the ones participating in the collaborative review process. We're happy to include you in on that call. I think that could be really helpful for you all to be included in on that conversation about policies and procedures. And I think also, just so you have this in mind, if you're sub-granting to other agencies, we would want them to be participating in our field support calls and our training. So just making sure that they're included and wrapped into our field support in general, since they are the ones implementing the program out in the field. And Chris, I'm going to pause right here on questions because I think I accidentally double-clicked past the last slide on your slide deck. And it's the one that's showing the program monitoring. Can you touch on these bullets real quick? I'm sorry about that. That's my fault.
Yeah, no problem at all. This is just the monitoring piece that we discussed. Our office will conduct no less than one desk monitoring for each organization per quarter. So before the end of this year, each agency here on this call and those that are not on this call potentially and will receive at least a desk monitoring from us on both fiscal and client file management. So you just want you guys to be aware of that. HMIS comparable databases are subject to random monitoring from ESG staff. But again, that's something with back at home, you guys work really well collaborating with the agencies and understanding HMIS and ensuring that that's being done. But just to let you know that that could be a monitoring from us. Subrecipients are expected to make available all participant level financial and program records for periodic review. Again, because of the suspension of the on-site monitoring, we may ask for more than what we normally would ask for in a desk monitoring. Those that are current rapid rehousing agencies through ESG you may be familiar with us just requesting a fiscal, a month of requisition documentation to provide the backing for that, and one client file. We may ask for additional information that we would have initially asked for had there been an on-site monitoring. Again, nothing to bog down an agency, but enough for us to understand and allow us to know that the agency has full control and a good grasp and capacity on the program. Any significant deficiencies found will result, unfortunately, in a plans for corrective action, which will possibly lead to a loss of allocated funds if the deficiencies continue. So all that said, if we do a monitoring and there are findings, we work with you to correct that. Our goal is not to pull funding, as I mentioned earlier, not to suspend funding, not for people, our agencies not to continue the program. We want to rectify the situation, work with you, develop a corrective action plan. And again, because this is outside of the norm of the normal traditional ESG funding, our expectation is that the back at home team would be right alongside you all to help in that process, which helps us to feel comfortable moving forward with you all utilizing the funds that's been awarded. So just wanted to share those last bullet points.
Thanks, Chris. Thank you. And thanks, Joanne and Ricky, for pointing that out. Sometimes my mouse is quick on the draw. Ricky Gardner had another great question. Are back at home clients able to be served with regular NCESG funds, meaning non-ESG CV funds? Chris, I'm going to let you respond to that, but quickly, I just want to say that I know a lot of agencies who are rehousing agencies with the back at home CV project have different sources of funding that are coming in to support rapid rehousing at your agency. We have already talked with COC staff and leadership as well about how we can coordinate and work together with different funding streams with back at home. Denise mentioned this yesterday morning that we want to be able to use you all as rehousing agencies to use various systems that we have set up for back at home for other funding that is going to help with rapid rehousing or targeted prevention in your community. So we're happy to talk more in depth about how to align that. I know we've had conversations with some communities who receive entitlement ESG CV funds to see how do the entitlement funds and the state ESG CV funds, how we can align those. We're happy to have conversations with that. Just let us know if that's something that you need us to have. But I want to, Chris, I'll turn it over to you to answer specifically if back at home clients are able to receive regular NCESG funds. Is this, I guess, Ricky, a clarifying question I have for you, is this, are you saying served from both pots of funding, or is it just that if we have a referral of a back at home client and you want to use the NCESG funds to serve them, is that possible? I guess is my, and Ricky, I'll let you have some time to write a clarifying statement.
Can I, Mike, and ask a question?
Oh, yeah.
Or?
Okay.
Oh, okay.
Go for it.
So to Chris's point earlier, rapid rehousing agencies have received way much more money than we've ever had. You know, thanks to COVID, in a weird way, thanks to COVID. So we have an opportunity to serve a lot of people. However, certain agencies that have a current contract with the state for NCESG, we have an obligation to spend down those funds as well. And so I was wondering if a rapid rehousing agency receives a referral from back at home and has both NCESG and NCESG CV funds, do they have to be served with the CV funds, or could they be served with the regular NCESG funds? So not trying to say that they would be served with both funds, but just would we be able to say, oh, this back at home person, we're going to do regular state ESG. This back at home person, we're going to do NCESG CV.
Technically, that makes sense. Technically, Ricky, they could. where I see the problem potentially being, they're two different contracts. So you would have to be astutely aware of those that you serve with NCESG regular funding. I guess you would just have to be very careful in separating that. Realizing that you do have an NCESG grant that's only a year's grant that you have to spend down. You do have NCESG CV funding that is a 24 months. And the distinction and the eligibility criteria for both are identical for those that you'll serve. So technically, you could do that. I just it's an internal decision because you have so much money again available to serve those clients. But I see what you're saying. If you utilize your back at home funding right away and serve all those clients, then you stand to put at risk your NCESG regular money because you're serving all the clients with the CV money that's available to you. So I can see the dilemma. Didn't really give you a good answer. Let our office reach back out to you as to maybe just talking through that a bit. And then Emily, we can share that with the entire group so that if someone else is faced with something like that, we can sort of help those that receive both pots of money.
Sure. I think another thing to just consider is that we've had extensive conversations with each coordinated entry system about how they want to prioritize ESG CV funding. So the way that your regular ESG grant is prioritized through coordinated entry may be different than how your COC wanted to coordinate ESG CV funding. So I think that's just another layer that they may want to be using ESG regular pot of money as a community to serve a particular targeted population that's different than the CV population. So depending on the back at home referral process, to prioritize your regular ESG grant, you may run into an issue with your community's coordinated entry process in that. And I just want to be very clear. I think, Ricky, you did a good job distinguishing this, but just underlining it for everybody. You know, definitely want to make sure you're serving someone out of one pot or the other with ESG and keeping clear track of who is being served by whom, because that involves HMIS data entry and a lot of other things. So just want to make sure that you're clear about these different pots of money that y'all have.
Yeah, no, that's super helpful. Thank you both, Chris and Emily, and I guess other things to think about this experience. So thank you.
You're welcome.
Yeah, absolutely. Does anybody else have questions? I know we still have a little bit of time, and I'm usually the one that thinks of the last question, so don't feel like you're holding us up. We have time for you to answer any of the questions that you may have. Please feel free. You can unmute yourself to ask a question or type it in the chat. We're happy to answer any that you have. Joanne, great question. If you have a question in the future, who do we contact? Right now, you are welcome to reach out to me, and I can help with coordinating and getting you to the right person. If you have a specific contracting question, that would be reaching out to the ESG office. If it's a field support and resource question, that would be reaching out to me, and I just chatted my email address into the chat. You all are welcome to contact us for those kind of field support, accessing the portal, things along those lines. That's where NCCH staff can be helpful. Again, if it's a contracting question, Chris just put in the email addresses for both Chris and Lisa. You can feel free to reach out to the ESG office for those contracting questions that you may have. Please be on the lookout from emails from us with the collaborative review process, our form and the self-review tool that you all can use to evaluate yourself on program standards, and then also an email out to rehousing agency point of contact about who they would want to have access to the portal. We will be sending those emails out. So Corey had a good question coming in. So would it be possible to serve a client using back at home services money and home TBRA? We have separate HMIS projects currently. Corey, I think we can talk about that for sure, because you all are not the only folks who are looking at home TBRA for rapid rehousing with COVID. So if you want to reach out to me, Corey, I can get you set up with the right folks for a conversation about how to coordinate that and what we just need to think through in terms of data entry and coordinating those processes. So I can get that conversation set up for you if you reach out to me. And that goes, again, for anybody out there that you have multiple pots, whether it's ESG, CV entitlement money, state money, home funds. We even have some local CDBG funds that are maybe using for rapid rehousing. If you as a rehousing agency have all those pots of money and you're trying to figure out how am I going to coordinate all this with back at home, please feel free to reach out to us and we can try to have that conversation. If it's a lot of folks, then maybe we can have a larger presentation about it. But I will definitely try to coordinate the right folks so that you all can feel clear about how you coordinate that use of funding. Any other questions from the group?
Emily, I think there was one from Ricky that didn't get addressed, which is,
Okay.
Is NCCEH taking care of all the HMIS reporting for participating agencies?
Ricky, that's a great segue conversation. Stay tuned to Thursday morning's training, or excuse me, tomorrow morning's training on data and reporting. It's almost like we planted it, Ricky. Tomorrow at 10 a.m., you all will have a presentation about back at home reporting, which will include the CAPER report and HMIS reporting and how that's going to be done for back at home. So please be sure to check out the call tomorrow, again at 10 a.m. on back at home data reporting. That'll have more information about CAPER. And then Corey, how long will self-assessment process take? We definitely know you guys are in the middle of a lot of stuff, so we want to get that out to you as quickly as possible and then reserve the next several weeks to go over it. So just want to give you guys the time that you need to do it, but also just know that it's not too self-involved of a tool where it's going to take several hours. We wanted to make it a streamlined process for you all. So we will definitely give you a couple weeks to do that. But again, we're trying to simplify that tool so it's easy for you all. Easy but meaningful is our goal with that. And Joe, it seems like you needed to or wanted to comment on Ricky's question. Please feel free to unmute yourself so you can comment.
Thank you, Emily. I was thinking about Ricky's question, and I know that the different funding sources get really confusing. You know, what do I use this for? What do I use that for? It's really easy to fall into that. And as I was thinking about it, I just want to make this comment. The purpose of the ESG CV money is to assist people that are affected by the coronavirus, which is a very large part of the population, and they can be affected in many different ways. However, there still are going to be people who are not affected by the ESG virus, who are homeless and require rapid rehousing. They may not have had an issue with coronavirus at this point, and still need, you know, a rapid rehousing assistance, and that's where the annual or the regular, or what I call the regular ESG money would come into play, and you could use it that way. Also, don't forget that ESG CV money can be used to pay people who were rapidly rehoused due to CV before the money went out. So that going back to the declaration, if you were rapidly rehousing people and it was because of the coronavirus, you can charge those to ESG CV if you haven't put in for reimbursement for them already. So I just wanted to make those comments too. And we'll continue to have the conversation in-house and try to make this a little bit less complicated, but I just wanted to make that comment.
Thanks, Joe. All right, any other questions from the group? Well, fantastic. Thank you all for your presence here and your continuing partnership and attention this week. We really appreciate you bouncing from training to training all week long with us. And as I said, the next one is at 10 a.m. tomorrow on reporting. So please stay tuned for that, and we will talk to you all tomorrow morning.